11 in the morning. We're now in the second hour of Trax Momentum. It is W Talk, and I am so excited to have a conversation with our special guest in the studio. And as the promo mentioned, when women talk, amazing things happen. And I promise you, the next 30 minutes is going to be amazing. So just an introduction, our topic and our guest today is actually related to what happened on March 8th, which was International Women's Day. And the theme for this year was Inspire and Inclusion, because it's a very pivotal time for us to highlight the struggles of women so that they can be inclusive in sometimes fields that are dominated by men. And hence the topic that we picked today, which is inspiring inclusion in the field of medicine. And to talk to us through this insightful topic, we have in the studios a consultant breast and endocrine surgeon from Prince Court Medical Center, and her name is Dr. Harjit Kaur. Doctor, good morning.
Good morning, Anil.
Welcome to TRAXX.
Thank you. It's
How are you
great
today?
Pleasure to be here. Yes, I'm good.
Likewise, the pleasure is ours as well. We're very excited to have this conversation with you. And I have to say, W Talk has been one of the greatest shows that I enjoy because it's constantly perpetually a session of learning for me, because I'm learning a lot from women who have paved the way for other women and other men as well to achieve the same things.
That's great.
So briefly, Doctor, before we start, tell us a bit about yourself.
I'm a practicing surgeon, a breast and endocrine surgeon at Prince Court Medical Center. I have been there for the last 16 years.
Wow.
And before that, I served about 15 years in the government service. Along the way, I've had 2 children.
Okay.
I'm married to a very, very wonderful man who is very supportive throughout my career.
I bet.
And I enjoy, the outdoors. I enjoy the outdoors. So a lot of my holidays are usually planned outdoors. We love trekking, hiking. So that's my go-to when I need to de-stress.
So shout out to the man the wind beneath your wings, who's your husband. Shout out to him if he's listening right now. Is he listening?
I hope so. I don't think so.
So let's talk about your journey being a surgeon. Maybe we can start off with the challenges, Doctor, because the challenges sometimes are something many people forget, but they are the sweetest moments that remind us how strong we are. It just reminds us that we have this muscle that we can use, and we can get stronger and stronger only if we use them.
Yes.
So talk to us about some of the challenges you faced.
Well, for me personally, as a woman in surgery, it has been the work-life balance, especially in the early years when the kids were young. You see, when we are training in surgery or any field for that matter in the medical world, you have very demanding schedules. You have long days at work. You have on-calls. And sometimes we're not home even for more than 24 hours because you are staying in the hospital and the patients are your priority. You have to be at the back end call. So the family very, very often used to take the back seat in the early years, in your training. And yes, there was a lot of guilt at that time, for sure. And that was tough because, you're not at home. When you're at home, you're also guilty because you need time to study because you're in training.
Yeah.
And so it was tough. So I still remember, I hope my kids don't hear this, but, there were times when I used to lock myself in the bathroom with my notes.
Wow.
So that they couldn't find me. Because when they didn't see me, it didn't hurt them. But when they saw me, they were, after me. And it was tough, to study, to work, and to find that level of balance between the two. So it was very, very hard. The stress levels were really high those days. But like I said, I was fortunate. I had a very supportive husband who's a doctor as well. So he understood the expectations. And my mom, she was my rock throughout. Yeah, I was fortunate that way.
Right. I think two things you mentioned. Sacrifice, I think that has to be highlighted with all capitals when it comes to pursuing a profession to become a surgeon.
Yes,
as well as dedication. To the point where you had to lock yourself up. Wow, that is. I'm imagining that. How would have Dr. Harjit locked herself up? But what was going through your mind when you did that, Doctor? I mean, did you feel bad for your kids? I'm sure you would have.
I mean, I did. Of course I did. But at the same time, I had no choice.
Right.
I had to find that time to sit and study because it was about studying. If you don't study, you don't progress.
Right.
You got exams to sit for. You got exams to pass, and they were not easy.
Okay.
Yeah, so it was tough.
Okay. Now let's talk about some other challenges you face, but not in terms of your professional skills, but in terms of the setting, gender biases. Can you recount a particular incident where you encountered discrimination in your workplace, Doctor?
Okay, see, to be honest, from the beginning when I started training as a junior trainee, I actually was very fortunate not to have any kind of gender bias in the initial period. I had a great mentor throughout my career. My boss, when I started in the Ipoh General Hospital, was essentially practicing inclusion, I think, even at that time.
Right.
Yeah, he was amazing. And he was the ultimate gentleman. I don't know whether I'm allowed to name him.
Of course, please.
Prof.
Please.
Dato Kandasamy.
Okay.
He was my mentor. I am what I am today because of him.
All right.
And he also trained many of us women surgeons. And the thing about him is he treated us as equal with the boys. But at the same time, he always added that extra kindness, recognizing that we were women and we had special differences. And that were needed to be looked into, but not at the expense of our jobs or giving special privileges or favoritism, not in that sense. But when I was training away from home ground, that's when I felt a few incidents, experienced attempts by some of the seniors who tried to undermine, bully me using their position.
Right.
Yeah. And, there was one who purposely refused to even acknowledge my opinions during discussions. But he would rather, take the answers of the male trainees, even though they were less accurate. So, things like that. But I never really let that faze me because, I was focused. I stood my ground because I knew I had to do this.
Yeah.
And I survived the whole thing. There were some statements made, like, oh, a woman shouldn't be a surgeon. You're not cut out to be a surgeon. Wow. You should be just the nurse that assists a surgeon. There were some of them who came up with statements like that, but I let it pass. To me, at that stage of my life, I think I just was very, very focused and just... went on and got on with it.
Wow.
Yeah.
You mentioned about this incident where, some of your seniors were not taking your opinions seriously and only took the opinions of the male surgeons. I did some research before talking to you. Yesterday, I came across an article which was a research published by researchers in Canada and America, and they found that female surgeons perform better surgeries compared to male surgeons because but they were trying to find out, like they were trying to put their finger on this one particular reason. Why is it that women are better surgeons than men? And they discovered that women are patient. They don't rush through the surgery.
Yes.
Your thought on that, Doctor?
Definitely, I agree with you. I think we are more meticulous. We are patient. And I don't think for us it's about having to show off.
Yeah.
You're doing your best for the patient, and that's the ultimate goal. So I think that's why we do things better rather than having an ego about it. Yeah. So
Right. Great.
Sorry, man.
Sure, we'll talk a little bit about men later on because there's a lot of things that men can learn from women too, and that's why we have you, Doctor, and it's such a privilege. Now let's backtrack a little bit. You mentioned about your mentor. Well, kudos to him because if it wasn't for him, you wouldn't be where you are right now, and it's a great thing that you were blessed with mentors. So have all of us. And mentorship. Two things I want to talk about mentorship. One thing is sometimes when a mentor looks at the potential of someone, and that's where they see a protege. So maybe perhaps your professor could have seen the potential in you. He probably saw something in you that you didn't know that you had within you, and he said, okay, this is the person that I think is going to take on the path and pave the way. And then another way of looking at it from the perspective of the topic we're talking today, which is women, is when women reach the echelon of a field that is male-dominated, perhaps she takes it upon herself that, I'm going to make sure that there are going to be more women. I'm not just going to be the only girl sitting at the top. I'm going to bring about and I'm going to lift the spirits of all of the other girls out there. Share us your thoughts about mentorship and how it has played a part in your success, Doctor.
I think that's very, very important. I think, in the past, there were very few women surgeons. At my time, I had no women surgeon as a mentor. So like you said, surgery was not even in my equation. I never even thought I'll be a surgeon because it was a male-dominated field. But here is the situation, like you said, I walked into the unit and he saw something in me that I didn't know I had.
Right.
And I still remember his words till today when he says, I'm going to make a surgeon out of you.
Wow.
And I was like in my heart saying, yeah, just you try, And true enough, within a month, there was no turning back because he gave it all. He supported, he encouraged, and he made it so exciting. So the same thing. When I became a surgeon, when I was moving up the ranks in the department from a medical officer, going up to become a junior surgeon, a consultant. So you tend to get a lot of the younger girls who are in your unit.
Yeah.
And they look at you and, they keep asking me questions like, how is it like? Because they have that interest, but that fear is also there, that whether they can fit in that surgical domain. So I like to think that we did set a good standard for them to follow because they saw that we could have work-life balance.
Right.
We could have a family because a lot of people always say, oh, you want to be a surgeon, you're going to be a spinster for life. That was the way some of the people used to say, like, you will never have time for a family. But I think these young girls, many of them saw that we could do it, we can. And I am proud to say that quite a number of young girls have taken up surgery as a choice of their career, and they're all doing very, very well. And that's the way it should be. We should lift each other rather than pushing each other down. Yeah.
Right. Part of what I was, reading up about being a surgeon is I was looking at what are the important skills that a surgeon needs, and one of it was dexterity. You have to be ambidextrous. So maybe you just want to pick on your brain a little bit, Doctor. Did you develop that dexterity? Did you have it? How did that work for you?
I don't know. I enjoyed surgery, so I was doing quite well. So I think I like to think I have it.
Right.
But I think all of us need training along the way.
Right.
So you make yourself better. We go for training courses. We keep going for workshops to improve ourselves.
Right.
There's always room for improvement, and things are just getting more and more advanced. You can't just be left behind. You have to move with it.
Yeah.
And keep on learning. Yeah.
That's another thing that I saw highlighted as well. To be a surgeon, you have to keep up with the pace of technology. You have to adapt because being a surgeon, you're not just equipped with a scalpel when you go into a theater, operation theater. You also, expose yourself to technological equipment, right?
Exactly.
Okay, let's jump in for a quick break, Doctor. When we come back, we shall resume with our discussion. Today on W Talk, Anil on the mic is not alone in the studios. I'm speaking to Dr. Harjit Kaur. She's a consultant breast and endocrine surgeon at Prince Court Medical Center. And today we're talking about inspiring inclusion in medicine. Here's More Than a Woman by the Bee Gees. Don't go anywhere. We'll be right back. Talk. Yeah, we've moved W Talk to Tuesday, so it's no longer Fridays. My apologies. Welcome back. It's Anil on the mic, and today in the studios we have Dr. Harjit Kaur, a consultant breast and endocrine surgeon at Prince Court Medical Center. And today Dr. Harjit is speaking to us about inspiring inclusion in medicine. Dr. Harjit, welcome back to W Talk.
Thank you, Anil.
So, Doctor, I went through your profile and I understand that you had some part of your training in Australia,
Yes.
land down under. So what influenced your decision to introduce advanced breast cancer treatment services like, for instance, sentinel node biopsy and oncoplastic surgery into the Malaysian healthcare landscape, Doctor?
I did my 1-year fellowship at the Royal Hospital in Perth, and I think that was a very, very important part of my career. The gold standard of treatment at that time was the sentinel lymph node biopsy.
Okay.
Now, this is part of cancer surgery very quickly. It is just a minimally invasive way of dealing with the lymph nodes,
Okay.
as compared to the traditional way where, there's extensive surgery being done to the lymph nodes, causing quite a bit of debilitating effects to the women after that. So this procedure made it a lot better for the women in their outcome. And we didn't have this service in the country at that time. So I learned and trained in that and was very eager to start this service in the country.
I see.
And at that time I was working in Putrajaya Hospital. But, unfortunately, there were a bit of delays in trying to get isotopes. So I finally, started the first procedure in Prince Court Medical Center.
I see.
So we started performing the sentinel lymph node biopsy. And I also trained in breast reconstruction, and that's what oncoplastic breast surgery is. That's performing immediate reconstructions for women who required mastectomies when they had to lose their breasts. So we did an immediate reconstruction so that, it made accepting the surgery a lot better for the women in their emotional outcome, physical outcome, psychological outcome. So I think these are the things that, I was very keen to do when I came back, because it was not freely available in our country at that time. We were very much dependent on plastic surgeons, which were also not many in number. So many women had to suffer with mastectomies without having the options of reconstruction.
I see.
Yeah.
I was watching a video of you yesterday giving a keynote speech about breast cancer, and then one thing that you mentioned, one bit that you mentioned was women often wait until they hit menopause to, go and get themselves tested to see if they have breast cancer or not. And that sort of caught my attention. And I thought to myself, well, I'm going to ask you, since, you're an expert yourself, so maybe our listeners can get some value. So talk to them, Doctor. What are some of the things they should look out for? Some very brief telltale signs on, if they are potentially, going to suffer from breast cancer or not?
I think the key every woman needs to know is that you need to know your breasts. You need to recognize what's normal, because unless you know what's normal, you're never going to pick up anything abnormal.
Right.
So practice self-breast examination from young. And I would personally advise women after the age of 25 to start practicing annual screening ultrasounds, because we are seeing cancers in younger and younger women these days. Gone are the days where you see cancers in older women. Many of our women now are in their 30s and 40s. And even in their 20s. I have many young ladies in their 20s getting breast cancer. So you're not exempt from screening. So don't wait till you're menopause. Don't wait till you're, older. Start young. Recognize all this. And it'll save your life.
Wow.
Yeah.
Okay, 25 to 30. I mean, that's the age group right now.
Yes.
And the statistics out there to prove this.
Yes. It is being seen more and more, not only in Asia, but even in the European community.
Wow. Okay. And in your transition from government hospitals to private practice, how have you worked on fostering inclusivity and support for women within the medical profession, Doctor? How have you, sort of encouraged that?
Well, I mean, being in a private hospital becomes a little bit tricky because, number one, you don't really get a chance to teach as much as you would have liked to. But we still do get a lot of young students coming and attaching themselves with us. So I've had quite a number of young girls in the med school and also even pre-medical school. They come and attach with me in the clinics to see what being a surgeon is all about, being a doctor is all about, and learning. So I like to think that many of them have gone on to become great doctors. So I think that's what we try to do in the private practice.
And this still touching on that, Doctor. wouldn't be a W Talk if I never asked you this. What advice would you offer for the young female doctors out there who are listening and who want to, navigate their way into the profession of being surgeons in the country? What's your piece of advice for them?
I think the most important is, advocate for yourself. Be very sure with what you want to do. And if it's surgery, go for it. Don't ever allow anyone to influence you to say that you can't do it. And I think find the right mentors. That's very important. Try to attach yourself to consultants, women or men, it doesn't matter. Just good mentors, someone you can emulate, someone you can learn from, and someone who will guide you. And I think that is very important. You need good guidance because it directs you in the right flow. It guides you as to how to go about getting your degree the right way, the quickest, the best way, and without getting lost along the way, I would say. Because in the medical field, you can get pushed around, getting postings that, and getting stuck there for some time. That's the tricky part.
Right.
And coming back to get on back to the field that you're interested in sometimes can take years. So that's why it's important to get someone to help you, someone to guide you, get good mentors to work yourself towards it.
Get good mentors and also develop a deep sense of resilience as well. Because as you mentioned, Doctor, the journey ahead is long.
That's very important. You need to be resilient.
Okay. Wow. Doctor, we're going to jump in for another quick break. When we come back, we'll resume with our discussion, and I believe you're going to give our male listeners some advice on how we can navigate ourselves through our professional life. Today on W Talk, I'm speaking to Dr. Harjit Kaur. She's a consultant breast and endocrine surgeon at Prince Court Medical Center, and today's discussion is on inspiring inclusion in medicine. Here's RESPCT by Aretha Franklin right here on W Talk. You Talk on Tracks Momentum. I'm Anil on the mic, and today joining us in the studios is Dr. Harjit Kaur. She's a consultant breast and endocrine surgeon at Prince Court Medical Center, and Dr. Harjit today is speaking to us about inspiring inclusion in medicine. Dr. Harjit, welcome back to W Talk.
Thank you.
Now, we sort of gave a teaser to our listeners before we went in for the break that you will have a message, a very special message for the many men listening out there. Doctor, how should they be treating their female co-workers? Since we're talking about inclusion, how do you think they should be treating the women that they work with, Doctor? Talk to them.
I think it's very important, first of all, I mean, our male colleagues to understand that we are women.
Yeah.
We are not one of the boys, and neither are we meant to be. So we are, however, equally competent intellectually in our skills and our overall, duty as a doctor. So there should be no bias in that aspect. So when you have male or female trainees under you, I think you need to recognize that they are all equal. But as I mentioned before, they also need to understand that the women are wives and mothers. So respect that and understand that it is not a weakness, but it is rather a strength. A woman has to, have children, she has to be pregnant, she has to breastfeed, and she has to work at the same time, give 100% in all aspects. And at the same time, very sad that sometimes in our setting, when you're in training, you're only allowed things like only 2 weeks of maternity leave.
Only 2 weeks?
Exactly, you said it. And this is what stresses a lot of women in training.
Wow.
And it is rather unfair. So I feel this is where the system, the whole medical fraternity should relook at things like that. You cannot expect a woman to get back to work in 2 weeks. But, the males, they just get on with life without having to do all these added things. And yet, they are revered as the better trainees. So I would encourage all my men colleagues, that encourage your young women trainees, treat them as equal, give them equal opportunities, and be good role models for the males who are training under you. That is my advice to them. Because if you train good young men under you who emulate you, they will go on to create further inclusivity in the whole profession.
Yeah.
And you don't need to teach them these things.
Yeah.
It should come naturally.
Yeah, otherwise it becomes a vicious cycle because, those who have been terrorized would go on to terrorize other people who are under them, and then it's a never-ending cycle, right?
Exactly.
And then they go on replicating the same thing. And what strategies have you implemented, Doctor, to balance your career as a surgeon with your personal life?
I think in the beginning it was tough, like I said, because when you're young, you're training, you hardly have time for yourself. There was never me time, as I said. But as the time goes by, when you're a little bit more settled, I think it's very important to have a good social circle of friends and family. That's very important. You need to time management. Easier said than done. But if you're going to work 100% when you're working, then I think you've got to give yourself time 100% when you're not. So I, like I said, enjoy going for hikes, trekking, and I've got a good, like-minded bunch of friends, so we travel together. So when we're having a good time, we're having a good time. And when we work 101%. And I think that's how I've got away all this while and still alive and kicking.
You are. You certainly are. And you're inspiring all of us here in this conversation. Dr. Harjit Kaur, thank you very much for setting aside your time for being with us here today. Now, this wouldn't be a W Talk if I didn't ask you this question. This is a segment where I like to call a seed planting moment, where I give you an opportunity to look into the camera and speak to the millions of girls and women out there and plant some seeds of inspiration for women who aspire to be in a similar leadership position and reach the echelon that you have reached in your life, Doctor. So I want you to speak from your heart, speak it out into the camera, into the microphone, and inspire all the women. Take it away.
I think it's so important for you to always believe in yourself. I think never let anyone say anything otherwise. Keep it in your heart what you want to do and go all out. Get every possible avenue be made available to you. Get all the support that you can and go for it. Never hold back. You make mistakes along the way, that's fine, but go all out. And for women out there, I mean, I wouldn't be a breast surgeon if I didn't tell you this. Please get yourself checked regularly. Breast cancer is on the rise. Now take care of yourself. Unless you are in good health, you will not be able to take care of the others who are, look under you. So take care of yourself, be breast aware, do your health screenings, and I think my job is done here today.
Right. Thank you very much, Dr. Harjit Kaur. It was
Most
such a
welcome.
pleasure.
Thank you so much for having me.
You're welcome. We look forward to seeing you. Have a good day ahead.
You too. Thank you.
All right. And that was Dr. Harjit Kaur, a consultant breast and endocrine surgeon at Prince Court Medical Center. And today, Dr. Harjit spoke to us about inspiring inclusion in medicine. Very insightful conversation, which is in line with us celebrating International Women's Day on March the 8th. And, just to wrap things up, I thought I would share this one article that I read. And it's about inclusion, really. It starts off with a 19th century Chinese saying that goes like this: a woman is vulnerable, but being a mother makes her strong. But this was a saying that was coined back in the 19th century, 100 years ago. And we living in the 21st century would have not had a clue of how women would have, the situations they would have faced. So the only thing that the women were expected to do was sit at home, look after the kids, and maybe teach them. But I think fast forward many, many centuries later to the 21st century, we know today that women are not vulnerable. Give them a scalpel and she can become a surgeon and come over to TRAXX and have a conversation with us. Thank you very much. Have a good day, everybody. I'll see you in the third hour of TRAXX Momentum.